No, I'm not necessarily for the cough, but I've heard that people have said that that's one of her problems is that Bill gave her syphilis.
No, that's too easily treatable. It would be hard to believe that. It'd be hard to believe that it would get to an advanced stage. But people have speculated about how severe her concussion was. Has she really recovered from all that? But this is the problem. It's all speculation. One of the simple questions I asked, and of course nobody knows the answer, is, well, she has this cough. Well, has she had a chest X-ray? I don't know. She probably has, but we don't know. And it's like I said, when you have these sort of random symptoms, you can piece them together in any way, shape, or form that you really want, and almost come up with any diagnosis that you want. Really, the only one that's going to know for certain would be her own physician, and that assumes both that she allows her physician to do what needs to be done. In other words, the physician may say, "Hey, we need to get a chest X-ray," and she may say no. Or the physician may say, "Look, you have reflux, so you need to go on, like Nexium," and she may say no. So she may have some simple problems, and she's just refusing to take the treatments. We don't know the answers to any of those questions. So anything is really purely speculative.
Okay.
Is that a roundabout enough answer?
No, that's perfect.
What are the glasses for that she had to wear?
Apparently, after the concussion, she had double vision. So she had to wear something. I had to actually look this up. They're called Fresnel glasses. There's some kind of particular prismatic glasses that helped with the double visions. And I guess she had to wear them. They said that she would wear them for a couple of months. So apparently the concussion was pretty severe.
Wow. Okay. I know this isn't anywhere near your field of specialty. At least I'm sure you haven't covered it since medical school. But since they are admitting that she had a concussion, I've had a concussion. I know what it does to me. What can you tell us out of your knowledge from medical school 30 some years ago? How would a concussion affect her possibility of being able to do the job of president?
Well, you don't have to go back to medical school. I mean, look what they've done with National Football League has brought the whole concept of concussions into the forefront. So, I mean, most people that have concussions, the majority of people that have concussions, assuming that they're not repeated, recover from them fully. They completely recover from them. Is it possible that as a result of the severity of this concussion, she has, as some have again speculated, that she has some kind of brain damage? I found that hard to believe because, again, I didn't have the impression her concussion was that severe. It wasn't like she was in a coma for 6 weeks. So there are issues with possibility of short-term memory loss and things like that. And people, for example, in her FBI testimony, claimed repeatedly that she didn't remember. Well, you know what? Everybody, when you're being investigated by the FBI, claims they didn't remember, whether you had a concussion or not. So I don't know that you can put all that much weight into that.
Yes,
I mean, you could try to draw a conclusion between the two, but I don't know that's it could be real, but I don't think it's necessarily real.
Yeah,
I'm pretty sure there were.
I don't recall.
Emails came out that her aide, Huma Abedin, claims that she's confused quite often. Can that be a result of her concussion?
Possibly, or maybe there's something else going on. I've heard people say that she has Parkinson's. I mean, the speculation is rampant. The speculation is absolutely rampant. And unless she releases her medical records, which probably she'll release right after Trump releases his tax return, we're never going to know. We're never going to know these answers because we don't know what testing has been done. We don't know what the results of those tests are. I mean, time will tell. You know what's going to be interesting to me? I think the big test is going to be at the when she has to debate Trump, and let's see how she behaves. Let's see if she's coughing during the debate. Let's see if she's shaking uncontrollably. I mean, this is going to be a great time to really closely observe and see how she does.
Oh, that's a great point. I never thought of that. But yeah, she's up there. She gives a rally. She gives a speech for 15 minutes and she's gone.
Right.
Yeah, the debate. She's going to be up there for an hour or two. And like you said, if she's got a problem, they're not going to be able to hide it.
Right. So,
have you seen the photographs or the video footage of the large black Secret Service guy carrying what looks like a injection needle in his hand?
Yes, I've seen that. I've also, the latest one, I just saw it today on Facebook, or maybe it was last night, but somebody was commenting that they think she has a bulge in her leg, meaning she has a Foley bag, meaning she's catheterized because she can't control her urine. I mean,
it came out in her emails. It came out in her emails that she does wear Depends.
Is that right?
In emails. Yes, sir. That absolutely came out. But she's also 70 years old.
Well, that's
right.
I mean, right. There are a lot of women, that need to wear space, and especially realistically, and I'm not joking here, but if she's coughing all the time, a lot of women that age have difficulty controlling their urine if they're coughing, especially if they're coughing hard. So I wouldn't put it past her.
Yeah,
I don't really see it as much of an issue. I'm more concerned with her mental state. I would personally, if you ask me, I'm way more concerned with medical records than tax returns if somebody's running for president.
Right.
Because they're all going to try and cheat on their taxes. They're a bunch of millionaires, if not billionaires. They're all going to cheat on their taxes.
Right, and we don't like to know. I'd like to know what Trump's blood pressure runs and what's his cholesterol level and everything. I mean, you're right. I mean, there's some validity to that. I mean, Trump is not a complete picture of health either. We don't know. So I agree with you. I think that there is some more legitimacy in many ways to what their health is like than what their financial shenanigans were, because they all have them, every one of them.
But I think we have about the same chance of finding out her medical records as we do hearing one of her Goldman speeches.
Well, maybe I'm wondering if that's what Assange is going to release in October, because he claims he has a bombshell, and I wonder if it's either not going to be one of those or maybe something related to her health.
Yeah, I can't imagine that she did all these speeches. In this day and age of everybody. Well, I don't have a smartphone, but most everybody has a phone that's capable of taking at least audio, if not video. I just refuse to believe that during at least one of these speeches, one person in the audience wasn't sitting there taping the whole thing and has it saved on their hard drive or something. There's no way.
Yeah, I have to agree with you, but. Listen, who knows?
But I wouldn't.
You weren't at those speeches. Maybe they collected everybody's phone before you
walked in. I was just ready to say. Hillary Clinton is a paranoid person because she knows how much she lies. She knows. She knew that if she gave those speeches, that a lot of people weren't going to like what she had to say. So I can see them frisking people at the door and taking their phones.
Yeah,
I wouldn't put it past them at all. Just like when she has a rally and people show up, she makes them sign a pledge on their way in. They have to sign up. They're pledging to vote for Hillary before they can attend her rally. All 200 of them.
Well, obviously that's things.
But yeah, I could see. Or you're in the audience and you're filming Hillary. I bet your Secret Service guy taps you on the shoulder and takes your phone and deletes it. I mean, that I wouldn't put it past them. I think that probably those probably were pretty well controlled.
I've also heard theories from people that there were no speeches, that the speeches actually they never happened, that's just an excuse that they used to give her the money. and call it a speaking fee.
No.
Well, I would think if that was the case, they would at least have her come in and say hi, do a meet and greet or something. They wouldn't just, say she was here when she wasn't.
Well, yeah.
Who knows?
Yeah. No, I agree. I think it could easily have been a meet and greet, or her speech could have consisted of, "Hey, thank you for having me. Love seeing you guys," and So I mean, right? There may have been there may have been nothing of substance in her speeches, and that's just as damning as well. If you hear one of her
Absolutely.
speeches and it's 3 minutes long, and it's mostly, "Hey, I just want to thank Bill for inviting me, and John, good to see you again, and thank you, and enjoy your lunch." I mean, and then
she gets a $250,000 for it.
Right.
Yeah.
Right.
Yeah. Okay. Hey, listening to Green Party Radio. We're on the Blog Talk Radio, the Bernie Kratz Radio Network, with Dr. Joe Imperato, Harvard-educated oncologist. He's been practicing for over 30 years. He's really given us a lot of great info. I want to get back. I love talking about Hillary, but the reason we had you on actually was for your medical knowledge and for the Green Party is all in for Medicare for all, which Hillary used to claim to be. Now I don't think she's even claiming that she wants that. But what do you think the chances are, Doctor? Do you think we'll ever reach a point in this country where we can join the rest of the civilized world, basically? Everywhere else you go, they have, health care is a right. The government goes see a doctor. You don't have to worry about your insurance company and co-pays and everything else. Do you think there's a chance that could happen in this country as powerful as pharmaceutical and insurance lobbies are?
I think what we will get to is we're going to get to essentially a two-tiered system. So I think that the vast majority will be essentially a single-payer system. And I'll tell you, since the 90s, it's no longer going to be Medicare for all. I think it's going to be Medicaid for all. Because Medicare now would probably be too expensive. So I think what you're going to see is that the vast majority of people, kind of like a lot of the people that are on Obamacare, it's basically going to be Medicaid for all, and then there will be a small portion of the population based either on their jobs or their personal income that are going to be able to afford a higher tier insurance. Just like every country that has socialized medicine has a two-tiered system, where you want to pay out of pocket, you get moved to the front of the line and stuff like that. I think we are headed there, and I think if Hillary wins, my feeling is she will finish what Obamacare has essentially started. And I think you're going to see further consolidation of the health insurance industry. You're going to see further consolidation of providers, so hospital systems getting bigger and bigger and bigger. I think you're going to see all of that as we go towards that single-payer system. We will get there.
Okay. I just came into my head another question because you mentioned hospitals. One of your blogs, the topic of it was, the rating system for hospitals, and how it doesn't mean a damn thing. And I can speak a little bit to this personally because I worked in a hospital for about 4 years. Now I wasn't in the medical field. I ran the linen department. Okay. So, but I mean, because of that, I knew everybody because everybody needs linen. And I saw, because they checked us out too. You knew months in advance when these people were coming in to rate your hospital. They came in, you wined them, you dined them, you 69'd them, and you were putting your best foot forward. So yeah, can you touch on that? How the hospital ratings don't follow them; they don't really mean anything.
Okay, so you have to understand how these rating systems work, and to my credit, although nobody will give me this credit, I talked about this back in 2010 when I was president of the medical staff at Lake Forest Hospital. I stated that these rating systems were a joke because what they do is they will choose, let's say, 10 criterion. So we are going to measure you on these 10 criterion, and that's going to be the basis of your rating. And my first comment is, well, everybody then is just going to focus on those 10 criterion, and the rest can go to hell because it doesn't matter. They don't get measured on that. And so there are hospitals that, without a doubt, are very good at gaming the system, and so they get the top rating. There are other hospitals that, based on the fact that they serve, for example, an indigent population, that cannot possibly meet those standards. They can't. They just cannot. So they'll get a lousy ranking, even though they are providing an extremely valuable service, and they're providing excellent care to the extent that they can, based on the limits of their resources and based on the types of patients that they're seeing. And you can go to a 5-star hospital, and you can be sitting there and buzzing the bell all night, and there's no nurse available to come around to give you your pain pill, but they'll still get their 5-star rating because they fulfilled all these other criteria. So that's what people have to keep in mind, is these ratings are based on well-defined criterion, and there's multiple rating systems, and each one uses different criterion. So you can pick and choose which one you think is going to be the one that's going to get you the most bang for the buck as far as your PR. So all the hospitals decide which ones they really want to be ranked top in. Like Northwestern, for example, wants to be in the top 10 of the U.S. News and World Report. And they are, and they're within, they're ranked as one of the top 10 hospitals in the country, and that's their goal. But in terms of the Medicare, they were ranked only 3 stars out of 5, which is kind of like an average grade. So how does that make sense? How can you be one of the top 10 hospitals in the country, yet Medicare ranks you as average? It just depends on the criterion, and also when you're an academic hospital, you're dealing with typically you're dealing with very sick cases, because that's why they're coming to you. The community hospital can't handle them, and you're not going to be able to fulfill all of these criterion.
Sure, yeah, like I said, with my personal experience, I remember when they came around to do the ratings, and I can't remember the company, it's been too long ago. And they came in to tell me certain things we, as the linen department, needed to do to make sure these people were okay with us, keep the carts covered, whatever BS it was. And I'm thinking, really? I mean, we're passing out towels and sheets. You care how we do our job as you're going to rank the hospital? I'm not going to a hospital to make sure I got a hot towel as I'm waiting for the doctor.
I mean, some of the criterion make sense, and some of the criterion have been useful, but some of them are like patently absurd. They have, for example, what's called never events. Okay, so in a hospital, no one should ever fall in a hospital. Nobody should fall out of bed, fall going to the bathroom. That should never happen. So my comment was, well, you're an inner city hospital, and one of the things your ER is seeing are all of these like drug addicts that are coming in, and of course you can't restrain them anymore. That's a no-no. You can't restrain. Nope. So this guy that's going through DTs and heroin withdrawal jumps out of bed and falls. You're going to get dinged for that. Well, I mean, that's meaningless. That's insane. So there's a lot of these criterion, and here's the problem: some of these criterion are established by the government. They're established by non-physicians. Determine, this is really what we should be looking at, and that's why, and they don't make sense. But nevertheless, that's what the hospitals have to follow, and that in order to get top ratings.
Well, sure. No, nobody wants grandma to fall, getting up out of bed, going to the bathroom. You would hope there's an aid to help her. But, yeah, if somebody is in there because they overdosed on PCP and you can't restrain them, how are you going to keep them from falling out of bed?
Right.
It's ridiculous. Right.
So, but so that's the problem. So and there's rating systems for doctors, for example, and so here's what, one of the biggest things, and I'm going to drag this into the conversation because I think it's so pertinent right now. We have this opioid epidemic in this country. Prescription drug overdose. All right, it's a huge problem. Well,
yes.
One of the reasons is that in the past, a drug addict would go to the emergency room and try to get some prescription, some pain pills. And the ER doc would look at his record, see that this guy's been here, several times before, talk to him about, maybe considering going and getting in a different, option to go into rehab, things like that. Now, the problem is these guys come in. First of all, the ER doc is measured on productivity, meaning he doesn't have hours to spend with a strung-out drug addict to try to convince him of going to rehab. And number two, if he doesn't give the guy the prescription for some pills, the guy will go out, and then he gets in the mail from the hospital a Prescaney, basically a form saying like, how did you like our service?
Mm-hmm.
So the guy's going to give everything like bad ratings, basically Fs, saying because he didn't get his stupid drugs. So then at the end of the year, they're going to pull this doctor and say, "Man, you got a whole bunch of like really bad ratings. We're not going to give you an increase, so we're going to have to let you go." So now if some of these guys walk into the ER. They just write him a script for 5 pills, just number one, to get him out of there, and number two, so that at least they're happy. So if they get a stupid survey, they'll say, "Oh, this guy was great."
Yeah.
So
when they get that,
it's just
they get that Prescaney in the mail. Yeah, they give him a 5. Yeah.
Right. So it's ridiculous. This whole rating system has gotten. It's just gotten completely out of hand. It just makes no sense whatsoever.
Okay, and this is completely off the wall. Don't answer if you don't feel comfortable, but just my own personal experience. Because luckily I don't have a problem with pain pills. I prescribe 90 a month. I need them. I have nerve damage in my back, and I have bad arthritis from a car wreck. I need them just to function. But the thing is, I could get the same thing if I smoke a little weed. I don't hurt. I can function just fine. If you have, and lots of states at least now have it, if you have medical marijuana, you could do away with I think a lot of these people going out and trying to get pain pills, going to the ER for a bill they can't pay just so they can get, like you said, 5 pain pills so they can get high that night. What do you think about medical marijuana? And I know it does relate to you because they say a lot of it helps with cancer. So what's your opinion?
Well, I have been a extremely strong proponent of medical marijuana from day one. In fact, to be perfectly honest, I think they should just legalize it 100%. Just legalize marijuana completely, like they've done in Colorado, for example.
Yeah.
But from more than just a medical standpoint, that makes sense. I mean, look at how much money Colorado has received in tax revenues.
Right. Which, of course, they can't put into banks because it's still federally illegal funds. Which, some of the absurdities are just beyond comprehension.
Mm-hmm. The simple fact that a child having a seizure can be helped from cannabis oil. That alone, just right there. I don't care if it won't do anything else except for help a little kid with a seizure. Gives medical marijuana justification.
Yeah, I don't know what I cannot understand how people are opposed to legalization of and forget the general use, but let's just focus purely on medical purposes. I don't understand how people could object to medical marijuana when we have these other unbelievably powerful and addictive opioids that are legal, legal for me to prescribe. How does that make sense?
Because the pharmaceutical company doesn't have control. That's why. It's because the pharmaceutical company doesn't have control. So they're going to spend money to convince you that marijuana has no purpose.
I don't know.
Other than recreation.
Honest to God, I don't know that it's entirely the pharmaceutical industry. I really don't. I think there's there is a bizarre undercurrent in our society of fear of marijuana that goes back to the 60s and even beyond with reefer madness.
Reefer madness. Yeah.
It goes farther than that. And listen, when it was because of the Rockefellers. Okay, the Rockefellers owned the paper mills and the trees that were used to make the paper. And hemp is a great alternative. It grows faster than a tree. It's got more uses than a tree, but it would have hurt the Rockefellers. Okay, and the campaign began then talking about how black people were going to smoke pot and rape white women. And this was all the way back in the the teens and the 20s, and then yes, back in the reefer madness time and before, they have spent a lot of money to convince people that marijuana is dangerous.
Yeah, you're preaching to the choir. At the very least, it should be allowed for medical purposes. Period. I mean, there's and I would say that the overwhelming number of physicians would agree with that statement. They would have no problems with the use of marijuana for various medical purposes. I don't understand it. It's beyond me. It's just beyond me.
Well, I can tell you from my own personal standpoint. My doctor, and this has been a couple years back now, they passed laws to where now to go in and get your pain medicine, ever so often you have to pass a drug test, And my doctor flat out told me, look, I'm sorry. The first time it happened, I'm sorry. You have to pee in a cup for me because I don't care if you smoke weed. It doesn't bother me, but, now the state says I have to. And because I don't smoke weed anymore, so I need my pain pills to function because weed isn't legal. It's kind of a catch-22. I have to pass the test, so I don't smoke anymore. And now I have to take, and I'm sure Dr. Joe, you're probably familiar with Seroquel, which is a powerful antipsychotic drug. It's for schizophrenics. That's what I had to take to sleep. Instead of smoking a couple of bowls and going to sleep at night. So like you said, doctors, I'm sure, are all in favor of it, and it doesn't make any sense.
Yeah, I agree.
Well, I'm sorry, but I cannot believe we've been on the air an hour. And
oh my God!
It's been awesome, Doc. I'm so happy we had you on. You were probably the best guest we've ever had. I mean, you've really informed a lot of people. Everyone, please go read his blog at chicagonow.com. Healthcare Mythologies, and you'll get a lot of good info from the doc, and you'll educate yourself when you go to your doctor if you have questions, because everybody has questions when they go to the doctor, especially something as serious as what Dr. Joe deals with is cancer. You've got a lot of questions. Read his blog, Healthcare Mythologies, on chicagonow.com, and you will learn. You'll learn so much. And Dr. Joe, man, we really appreciate having you on, and hey, hopefully maybe we can have you on again sometime in the future. Because I've had a lot of fun and I've really learned a lot. I hope our listeners have learned a lot as well.
Well, thank you so much for having me. It's been a pleasure.
Okay, hey, I really appreciate it. Larry, do you have any more questions for the doctor? I don't want to cut him off if you have any other questions.
No, I just wanted to reiterate what you said. I've learned a lot just sitting here.
Yeah, I mean the insurance companies, they've got us by the balls. I mean, just to say it how it is, and people probably don't realize, the general population, the doctors are on our side. Dr. Joe, I think, has educated us all that the doctors are on our side in this battle. It'd make their job easier if we had Medicare for all. They don't, because I'm sure, Doc, you probably have to, it's sad that when you treat a patient, you have to call the insurance company first to see what you can do.
That's right. That's literally what I have to do.
And it's disgusting. And we're supposed to be the greatest country in the world. Yeah, that you'll go see a cancer doctor, and he has to call the insurance guy to see if he can treat you or not. It's sad. Yeah. Doctor, I really appreciate having you on. It's been awesome. And everybody read his blog. Again, it's really great. ChicagoNow.com, Healthcare Mythology, Dr. Joe Imperato. Thanks again, Doc.
All right. Thank you, guys. Have a great day.
Hey, bye. Wow, I have to admit, man, that was awesome. When I asked the doctor to be on, I thought maybe 15, 20 minutes we'd have a little discussion on Medicare for all. But, man, I hope everyone was listening because that was really awesome.
Oh, I think we could have kept going. We could probably fill the whole show with that.
Yeah, well, that's, that's a good thing. See, we could have the doctor on again now because, like you said, there's so much more we could have touched on. We could have him on again, but we needed to cut him off because we only have 2 hours, okay? And
right.
You could fill this hour just bitching about Hillary Clinton, no problem. But
absolutely,
as you touched on at the beginning of the show, today it's the 15th anniversary of 9/11. And as I'm looking at the clock, let me put my glasses on because I can't read. It's 10:03 a.m. on the East Coast. By now, 15 years ago today, both planes have already hit the tower. The first plane hit the tower. People thought, somebody screwed up, a pilot error, whatever. The autopilot messed up. People thought it was an accident. Everybody standing around watching, and not too long before now, the second plane hit the tower, and everybody knew. Oh wait, this is bad. Okay, this is not an accident. Yeah. Something is going on here, and No, go ahead.
Why haven't I seen the footage of the plane that hit Trade Center 7?
Oh, wait, no plane ever hit it.
Nobody ever talks about that. They talk about the World Trade Centers coming down, and everybody pictures in their mind 2 buildings. 2 of the tallest buildings in the world.
Yep.
But there was another building there that housed a whole lot of financial information.
Well, there was 7 buildings there, and everybody, it's all about the 2 buildings that went down. But as you said, nobody, unless you're watching a documentary, nobody knows building number 7 went down as well, and no plane hit it. It wasn't crushed by debris falling.
And one side didn't fall and cause the other side. The whole thing came down in unison perfectly. It was just like the demolition of a building. I mean, it was perfect. The whole thing came straight down.
Yep.
That means all of the supports, all of the supporting beams, it's alleged that a fire caused it. The fire started by the Trade Center, spread, and caused this building to fall. So what they're trying to expect you to believe, and everybody's just believing it, is that all of the support beams on that building caught fire and melted and gave way at the same time, so that building could come down.
If you believe that, I got a big floppy wiener to dangle in your face.
Hey, people don't talk about it. People, the Twin Towers went down. 3,000 people died in the towers. Firemen, hundreds, over 100. I'm sorry, I don't have the exact number in front of me. Over 100 firemen were killed, first responders, and it was horrible. It was horrible. But like you said, everybody focuses on that, and rightfully so. I mean, that was the target of the terrorists, and hey, give them credit, they were 2 for 2. They wanted to knock both those buildings down. I mean, they've been trying since 1993. They blew up a bomb in the basement, trying to do it. Terrorists succeeded. Chalk one up for the terrorists, but the terrorists weren't after Building 7. They didn't give 2 rat's asses about Building 7. Why did it come down?
Nope.
You know why?
Well, it was part of the plan. It was part of the plan.
Yeah, it wasn't part of the plan of the Saudi government, but...
And maybe Israel and the United States.
Yeah. Well, I mean, and maybe the Saudis as well, because maybe there was... there was a lot of classified documents in that building. Maybe they had dirt on the Saudis as well in that building. I'm sure they did.
And maybe 15 of the hijackers were Saudi Arabian. Maybe.
Yeah.
No, that goes. I know that. Wait a minute. That's beyond maybe. That's a goddamn fact.
That's a well-documented, proven fact.
Mm-hmm. Amazing that an airplane can go into the Trade Center like that and everybody be incinerated instantly, yet the passport of the hijacker survives the crash.
Yeah, that's pretty strange.
That is strange.
Yeah.
And I got another strange one for you, Don. Remember in the news about a month ago, I'd say, the shooting in Dallas, okay, where the guys shot like 6 cops, were shooting in the crowd, all that stuff.
Yeah.
Well, and we sent the robot in to blow him up. Guess what was the only thing to survive that explosion?
His ID.
His ID. Yes, sir. Did you also know that the ID was a Army veteran with PTSD?